Okay, hello, this is our presentation on sexism for our Nursing 216 class.
Hi, my name's Megan. I'll be giving the background information on sexism. So sexism is the prejudice or discrimination based on sex, especially against women, but it can also occur against all genders. It creates internalized negative stereotypes that can produce self-fulfilling prophecies through stereotype embodiment and contribute to weakness and dependency. The stigma related to sexual orientation as well as gender identity weakens sexual minorities' ability to safely and confidently seek medical attention. This creates an increased risk of HIV and AIDS as well as STI infections. It also creates a large gender bias in emergency situations and mental health. So for emergency situations, symptoms can present themselves differently in women. For example, the female symptoms in heart attacks present themselves very differently from males. So men are more likely to receive aspirin, be resuscitated, or taken to the hospital in ambulances. And for the gender bias regarding mental health, men have a harder time coming forward about mental health issues due to a stigma that's been created by our society.
Hi, I'm Kate, and I'm going to talk about the impact of sexism on health. And just to start, it's important to remember that there's many ways that sexism can impact health. So these are just a few of them. And it's also important to keep in mind that there's various forms of sexism, there's various forms of health, and there are many groups that sexism can affect. So to start off with physical health, a study done by the American Journal of Medical Sciences examined the role that sexism plays in the health disparity between cardiovascular disease in men and women in the United States, because cardiovascular disease rates and mortality in women have exceeded those in men since 1984, and they continue to rise. And the study determined that exposure to sexism is associated with increased cardiovascular disease and mortality. So that's just one example of how sexism can impact your physical health. Sexism can also affect your mental health. The same study from American Journal of Medical Sciences correlated sexism with higher rates of post-traumatic stress disorder and substance abuse in women that experience sexism. And another study from an academic journal on women's health found that both overt and benevolent sexism, so conscious or unconscious sexism, are associated with higher levels of self-doubt, lower levels of self-esteem, and poor overall psychological states in women that experience sexism. Moving on, it's important to mention intersectionality. One study from Psychology of Sexual Orientation and Gender Diversity examined the sexism and mental health in women of various races or ethnic backgrounds, as well as women with different sexual orientations, and found that racial minorities and LGBTQ+ identifying women experience higher rates of sexism as well as mental health struggles. And lastly, it's important to look at health at different levels of the social ecological model. A study from the American Sociological Review examined sexism through a meso-level lens by looking at heterosexual married couples, as well as a macro-level lens by examining societal trends on a larger level overall. And they determined that on the macro level, sexism is universally harmful, meaning that it causes health issues to people who experience it and people who don't. And as well, it determined that on a meso level, specifically in heterosexual marriages, there are worse health outcomes for women who experience sexism.
Hi, this is Danielle, and I will be discussing sexism and its importance to nursing practice. Understanding sexism's impact on nursing practice is very important because gender bias is a problem that threatens the health outcomes of our patients. Although the effects of gender bias impact both men and women in the healthcare setting, a professional study examining gender bias in both men and women show that women face worse health outcomes than men when receiving treatment. In Glasgow, for example, a sample study of around 3,200 patients, with 1,700 of those patients identifying as female, found a difference in management of stroke care among the genders. Evidence shows that female patients had 11% longer wait times after arriving in the ER and were significantly less likely to be discharged with a prescription of stains or ACE inhibitors. Differences such as these pose severe consequences for the health outcomes of our clients, and we must be diligent in recognizing instances where gender bias is present. To acknowledge this problem and work toward achieving equity, it is helpful to identify cultural factors that potentially explain these disparities. At the patient level, possible factors behind these disparities include differences in the style that men and women describe their symptoms, or differences in the way that the sexes perceive themselves and their illness. At the provider level, unconscious prejudices and cultural biases also account for disparities in care, and they must be addressed by bracketing them. As future nurses, we must be aware of gender bias and monitor instances where it appears in the clinical setting because, as we discussed, these gender inequities have a great negative impact on the health of our clients.
Hi, I'm Grace, and I'm talking about health promotion considerations in response to sexism. So some basic steps or aspects of health promotion are education, prevention, and promotion. These enable people to take their own steps to care for their health on a long-term basis. When considering education, we can look at the issue where people of different gender and sexual identities don't have the same access to health care. This is because their differing needs are not acknowledged under a heteronormative healthcare practice. By educating healthcare providers and making appropriate healthcare available to people of different gender and sexual identities, these issues can be reduced. When considering promotion, we can look at the issue involving older populations. Health needs are greater among aging women compared with aging men, but women substantially have fewer economic resources. The research going into a study evaluated older men and women and found that hospital and physician services are in danger of understating these disparities by not accounting for underlying health needs. As people age, they require various types and levels of care, which can differ among genders. This directly influences how older generations are treated and cared for by hospitals and other services. Without resources, their health needs, specifically of older women, are ignored and can lead to further problems. When considering prevention, we can look at an example that shows the importance of focusing on the needs of everyone, and not just the majority group. For example, there are differences in how men and women are treated for the same disease or issues. A journal researched this subject and linked negative health outcomes to sexism. The example given in the study was cardiovascular disease. Although both men and women suffer from cardiovascular disease, it is more commonly addressed in men. This could be due to a number of factors, such as different symptoms in men or women, or differential treatment of pain. This is just one example, but it shows that by focusing on the health outcomes of only the majority group, it negatively affects the health of everyone else. Educating healthcare providers about care for people from different gender and sexual identities or backgrounds is an important step in addressing sexism. Alternative options outside of a hospital that offer care for individuals are themes such as therapy, as well as many holistic approach resources.
Hi, I'm Elizabeth, and to wrap up our presentation, this is a discussion question to help provoke some thought about the topic of sexism and what we covered in our presentation. So the question is, discuss some ways we can combat sexism and improve health outcomes for patients of different genders. And thank you for listening.